I recently had a patient referred to me for a very severe eczema flare. And when I gathered the history, this person had some mild eczema on their arms, their chest, they even had pictures to show me, and they were prescribed a strong topical steroid to put on the skin. They used this for a few weeks, it resolved the eczema, but when they stopped, they developed the worst eczema flare that I have seen in a really long time. They had redness, swelling, blistering, oozing, basically covering their body from head to toe. They were super uncomfortable, itchy, scratching, and just complaining that their skin burned. And when I saw this patient, I wondered about a condition called Topical Steroid Withdrawal Syndrome. And I'm going to talk to you guys about whether or not this is a real condition and what I think about it. Hey guys, I'm Dr. Laura Soong. I'm a board-certified dermatologist. Welcome to my channel where I talk about all things related to skin and dermatology. If you're new here, make sure you hit that subscribe button and the notification bell so you don't miss any of my future videos. So let's talk about four main things about topical steroid withdrawal syndrome. We're going to talk about what we know about it so far, what I think about this condition, how social media is affecting people in terms of talking about this condition a lot, and some alternatives to topical steroids if you think you're struggling with this condition. So what we really know about this condition so far is that really there's no defined criteria in the medical world to make this diagnosis. There's been a lot of speculation, some studies describing what this condition looks like, and what we know about so far is that it tends to happen with prolonged use of high-potency topical steroids, usually over 6 months, particularly on the face and genital area, is more common in women. And it presents as this like rebound effect where as soon as you stop the topical steroid, you get this really severe flare-up with redness, burning, swelling, skin pain, as well as all these little bumps, pus-filled lumps, as well as sometimes edema or swelling of the skin. There's also a lot of controversy in the medical community, particularly in dermatology, whether this is actually a real thing or not. There's kind of three main camps that, first of all, topical steroid withdrawal syndrome is potentially a real thing. The second is that people use topical steroids and it's simply just a flare of their underlying condition, usually eczema, once they stop, and that they just need better control of their disease. Or the third camp is that they have some sort of allergy to the topical steroid that's suppressed when they're using it, but then flares up once they stop. Personally, I think that this is a true condition and it can affect some people. But the important thing is, I think as far as side effects go, it is rare, but I think it is real. We do know that people who use prednisone, so steroids by mouth, when they take it for eczema, for example, and stop, they tend to get a rebound flare. So to me, it makes sense that if you're using a really high strength topical steroid and maybe you're not using it quite correctly, that you could get the same phenomenon and basically your eczema could flare or worsen once you stop. I also think we have to be careful not to cause too much fear mongering and phobia about topical steroids though. I personally, as a dermatologist, prescribe topical steroids all the time in my practice. I use it for psoriasis, eczema, a variety of other inflammatory conditions that affect the skin, and most of my patients get better with using topical steroids. They're usually pretty safe, have very few side effects, and if you can get by with a cream on the skin or an ointment, it's always better than having to take a pill by mouth. So when there's a lot of fear-mongering and a lot of phobia on social media, people just don't want to use topical steroids at all. And that can mean that a lot of people let their condition go untreated because they're too afraid of this potentially rare side effect, and they continue to struggle along and live with their skin being uncomfortable, itchy, burning, and active in terms of inflammation, and don't get better. I think we need more research about this condition to really fully understand why some people do seem to flare up once they stop a medium or high strength steroid, especially if they're using it for a long time. And also make sure we support people who might be going through this condition to get them the right treatment. It's important that as medical professionals, we don't just gaslight or brush things off. We need to acknowledge that people are going through something that's causing them significant discomfort and that there is a lot of suffering, and offer other treatments. If you have eczema, just know there are a ton of other treatment options now that are non-steroidal in nature. So things like light therapy, injections, for example, something called dupilumab, or even pills like upadacitinib. So chat with your dermatologist, look into these other options so that you can get your skin back under control. I think it's really sad that I see a lot of people on social media and online that have decided to just forego any treatment, and they're going 1, 2, sometimes longer years, just letting their skin continue to flare and hoping that it will get better at some point. Anyway, that's it for this video, guys. Let me know if you think topical steroid withdrawal syndrome is real, or if you've experienced something like this. I'd be happy to hear from you in the comment section down below. Make sure you give this video a like, and we'll see you in the next one.